Welcome Back to Eden with Clem. Today, we will discuss how to rid the body of the root cause of diabetes and dialysis using the late Dr. Sebi's methodology. Diabetes is a chronic medical condition characterized by elevated glucose sugar levels in the blood due to the body's inability to produce or effectively use insulin. Insulin is a hormone produced by the pancreas that regulates blood sugar by facilitating glucose uptake into cells for energy or storage. Without proper insulin function, glucose remains in the bloodstream, leading to diabetes. What are the type of diabetes? The type of diabetes are 1. Type 1 diabetes. This type of diabetes is primarily caused by an autoimmune condition in which the immune system attacks the insulin producing cells in the pancreas. Type 1 diabetes is commonly diagnosed in children and young adults who eventually require daily insulin injections or an insulin pump for management. 2. Type 2 diabetes. Type 2 diabetes is the most common form of diabetes where the body either resists insulin resistance, or doesn't produce enough. This type of diabetes is often linked to lifestyle factors such as obesity, lack of physical activity, and poor diet, though genetics also play a role. This type of diabetes can be managed with lifestyle changes, oral medications, and sometimes insulin therapy. 3. Gestational diabetes. This is the type of diabetes that occurs during pregnancy when the body becomes less sensitive to insulin. This type of diabetes usually resolves after childbirth but increases the risk of developing type 2 diabetes later in life. 4. Prediabetes. This type of diabetes, where blood sugar levels are higher than normal but not yet high enough to be classified as type 2 diabetes. Early intervention can prevent or delay the progression of diabetes. What are the symptoms of diabetes? The symptoms of diabetes are increased thirst and hunger, frequent urination, unexplained weight loss, fatigue, blurred vision, slow healing of wounds, frequent infection, e.g., skin or urinary tract infection. What are the complications of uncontrolled diabetes? If left unmanaged, diabetes can lead to serious complications including 1. Cardiovascular disease like heart attack, stroke. 2. Kidney damage such as diabetic nephropathy. 3. Nerve damage such as diabetic neuropathy. 4. Eye damage such as diabetic retinopathy and blindness. 5. Foot problems including ulcer infection and increased risks of infection. Management and treatment. 1. Ensure you monitor your blood sugar levels regularly. 2. Consume only a healthy plant-based alkaline diet recommended by the late Dr. Sebi. 3. Observe the do's and don'ts of the late Dr. Sebi. 4. Engaging in regular physical activities. 5. Managing stress and maintaining a healthy weight. 6. Applied the 2 steps of healing methodology, cleansing and revitalization. What is dialysis? Dialysis is a medical procedure that performs essential function of the kidneys when they are no longer able to do so adequately due to kidney failure or severe kidney diseases. The primary role of dialysis is to filter and remove waste products, toxins, excess fluid, and electrolyte from the blood, maintaining the body's internal balance. When is dialysis needed? Dialysis is typically required when kidney functions falls below 10 to 15% of normal levels and the kidneys can no longer remove waste, maintain fluid balance, or regulate electrolyte effectively. Common causes include 1. Chronic kidney disease (CKD). 2. Acute kidney injury (AKI). 3. End-stage renal disease (ESRD). Let's listen to what the late Dr. Sebi has to say concerning diabetes and people on dialysis machine and how to go about it.
Do you know that diabetes is one of our specialties? Over a dozen or more, and I'm going to name one in particular, Larry from New Jersey, is a policeman. Larry came to me in Honduras with diabetes at 600 level sugar. In 4 days, his sugar was normal. He came on Monday, and the Thursday his sugar was normal. The Nigerian doctor that came from Canada with his wife, he didn't want to come because he thought that I was a voodoo man, that I was some kind of off-the-wall herbalist. No, I'm not that. I'm somebody altogether different. I'm a different animal. 4 days later, his sugar was gone. What is it that I'm doing? Okay, I'm doing a simple little thing. I cleanse the pancreas duct. They usually say, they normally think that when a person has diabetes, the pancreas stop functioning. No, if your pancreas stop functioning for 1 minute, you are dead. What occurs is that the ducts of the pancreas, through which the insulin travels to get to your bloodstream, are clogged. I unclogged them. It took me 4 days to unclog them. And there goes your insulin again. Then I repaired the damage in the core of the pancreas. They call that the islet of Longerhorns. I began to clean them out because they are clogged up with that what? Carbonic acid. You've been eating a lot of starch. Now, dialysis, again, there is obstruction in the kidneys. Usually, or normally, it is calcification in the kidneys. Kidney stones, they call them. And all kind of other things caused by what? Inflammation. There is only one disease. There never been two. There's only one disease that exists. When I said that to the Supreme Court, they didn't want to accept it. But when I broke it down, they had to accept it. When we talk about the dialysis and we talk about the other one, which is the pancreas, diabetes, you are talking about obstruction. The mucous membrane has been broken down, clogging the system. We have to clean it out. If that occurrence takes place in the brain, you become crazy. Or Alzheimer's, if it occurs in the like in the joints, you become arthritic. Anyway, the mucous membrane has been compromised, a disease will be present. So yes, with dialysis, again, we break down the calcification and flush it out. We have taken people off the dialysis in 24 hours. Others, it take me up to 2 months, but eventually, they will be off. They will be off. Dialysis only means that the patient has been ingesting a lot of starches.
The late Dr. Sebi emphasized that to heal the kidneys and eliminate the need for dialysis, you must abstain from eating starchy foods, follow a cleansing regimen, fasting, and consume iris seamos, herbal teas, and spring water. Additionally, adhering to Dr. Sebi's nutritional guide and gradually increasing your intake of iron and potassium phosphate are essential steps. To address the root cause of diabetes and dialysis, there are fundamental, non-negotiable steps in the healing process. These steps, known as Dr. Sebi's 2 steps of healing methodology, apply universally to healing from any disease. He believed that there is only one disease, known as the compromising of the mucous membrane, and wherever the break takes place, manifests the disease we see. Step 1. Cleansing detox. This involves fasting with water, smoothies, or raw vegetables, along with cleansing herbs, iris seamos, and spring water. Alkaline fruit smoothies, tamarind, and green juice are also integral for those fasting. The goal is to perform a full body detox, flushing out mucus and toxins through intracellular cleansing, targeting every cell that makes up the body's organ and systems. Step 2. Revitalization. This step focuses on nourishing and replenishing the body while strengthening the immune system. It involves consuming revitalizing herbs, iris seamos, spring water, alkaline fruit smoothies, tamarind, and green juice, regardless of the type of fasting being followed. To achieve optimal result, it is important to consume food from Dr. Sebi's nutritional guide and drink at least 1 gallon 16 cups of spring water daily. According to Dr. Sebi, healing requires cleansing key organs such as the skin, liver, gallbladder, lymph glands, kidneys, and colon. The next thing to discuss is to explore the herbs that cleanse these organs and those that specifically heal the pancreas and kidneys. 1. Cascara sagrada. Cascara sagrada is a natural laxative rich in anthraquinone. When used in moderation, it stimulates bowel movement by irritating the intestinal lining and embracing peristalsis. It also supports detoxification and digestion, maintains healthy digestion function, relieves constipation, promotes colon cleansing, supports liver health, and boosts nutrient absorption. 2. Rhubarb root. Rhubarb root contains tannins, anti-inflammatory, antimicrobial, antioxidant, and anthraquinone properties, acting as a mild laxative and astringent. It balances gut bacterial and support gastrointestinal health with anti-inflammatory and antioxidant effects. It also helps to improve digestion, relieves constipation, reduces inflammation, and supports liver function. 3. Burdock root. Burdock root is rich in antioxidants, diuretics, anti-inflammation, antimicrobial, and inulin, a probiotic fiber properties. It helps detoxify the liver and the blood, lower blood sugar, reduces inflammation, supports skin health and digestion, strengthens the immune system, and promotes kidney and liver detoxification. 4. Blessed tissue. Blessed tissue is a bitter herb rich in anti-inflammatory, antibacterial, and antioxidant properties. It supports overall health, improves digestion, elevates bloating, enhances liver function, boosts appetite, and used traditionally for immune support. 5. Dandelion. Dandelion is rich in vitamins, minerals, antioxidants, diuretics, and anti-inflammatory properties. It aids in promoting detoxification and reducing inflammation, supports liver and kidneys health, improves digestion, reduce bloating, boost immunity, promote healthy skin, and assist in balancing blood sugar level. 6. Elderberry. Elderberry is rich in antioxidants like flavonoid with antiviral and anti-inflammatory properties. It helps to boost immune response, support respiratory health, enhance immunity, relieves cold and flu symptoms, reduce inflammation, support cardiovascular health, and promote healthy skin. 7. Mullein. Mullein contains saponins and mucilage which soothe and protect respiratory tissues. It is also rich in anti-inflammatory and antimicrobial properties that help to elevate respiratory issues like cough and congestion, supporting lungs health, reduce inflammation, and provide soothing relief for irritated mucous membrane. 8. Chaparral. Chaparral contains antioxidants and antifungal, antimicrobial, and anti-inflammatory properties that help to detoxify the liver, combat infections, promote skin health, and may support cancer prevention. It is also used traditionally for joint pain and respiratory health. 9. Guaco. Guaco is loaded with coumarins, which possess anti-inflammatory, antispasmodic, and bronchodilator properties. It is used traditionally for respiratory ailment, and its properties help relieve asthma and bronchitis, support respiratory health, reduce inflammation, soothe cough, enhance circulation, and ease muscle spasms. Please note that during this first step, Dr. Sebi's intracellular cleansing process, temporary detox symptoms may arise as your body adjusts and eliminates toxins. These healing reactions are a natural part of detoxification and include 1. Physical symptoms, under which we have fatigue, headache, digestive changes, skin breakout, body ache, flu-like symptoms, increased sweating, and frequent urination. 2. Mental and emotional symptoms. Under these, we have mood swings, brain fog, and heightened emotional sense. 3. Other symptoms include cravings, bad breath, coated tongue, dizziness, cold-like symptoms, and a metallic taste. These reactions signify your body's effort to cleanse, heal, and restore balance. During cleansing, if you discover that any of the above symptoms persisted for more than a week, or the symptoms become severe, persistent, or worsen over time, consult a healthcare professional. How long do I need to do a detox or cleanse? The duration of a detox depends on the individual tolerance and level of toxicity in the body. Typically, it is recommended that you detox for 7 to 14 days, water fast. However, 1 to 3 months is the best, as Dr. Sebi fasted for 90 days when he suffered from diabetes. So, Dr. Sebi recommends a minimum of 14 days. If you have health issues that make it difficult to fast on water, I recommend fasting on smoothie and raw veggie from Dr. Sebi's nutrition guide. Another common question is, how much of the cleansing herb do I need to consume? When using pre-purchased herbal cleansing package, follow the provided dosage instructions. If you are using cleansing herbs that do not come with the recommended dosage, I recommend that you research the recommended dosage for each. Typically, it is easier to make a herbal tea with a ratio of 1 teaspoon to 8 ounces of water for each herb. A large batch can be made using the same ratio. The second step is revitalization. What is revitalization? In summary, revitalization is bringing back the energy that was lost by the presence of disease. For those of you who are suffering from diabetes, you will need to consume the following herbs for revitalization to nourish and replenish the energy that the body must have lost due to the presence of the disease and the cleansing process. The herbs for diabetes revitalizations are: 1. Nopal prickly pear cactus. Nopal prickly pear cactus is rich in fiber, antioxidant, and essential vitamins like pectin and mucilage. Its properties aid in regulating blood sugar levels, reducing cholesterol, improving digestion, and supporting insulin sensitivity in diabetes management. 2. Hurricu wereke. Hurricu wereke contains anti-inflammatory, hypoglycemic, antioxidant, and essential nutrient properties. Its properties aid in reducing blood sugar level, support pancreatic function, and lower inflammation caused by diabetes-related complications. 3. Prodigiosa. Prodigiosa is a bitter tonic rich in antioxidants and natural hypoglycemic compounds. It enhances insulin sensitivity, regulate blood sugar levels, support liver health, and aid in digestion for diabetes management. 4. The sensitive plant, tea maray. The sensitive plant tea Marie contains an anti-inflammatory, antioxidant, antimicrobial, and bioactive compounds. It helps lower blood sugar, improve nerve function, and supports the healing of diabetic complications like neuropathy. 5. Stingy nettle. Stingy nettle is high in vitamins, minerals, antioxidant, and anti-inflammatory properties. It stabilizes blood sugar levels, reduces inflammation, improves circulation, and supports kidney health in diabetes. 6. Anamu, guinea hen weed. Animal guinea hen weed is high in antimicrobial, anti-inflammatory, and hypoglycemic properties and contains sulfur compounds and flavonoid. It helps lower blood sugar, combats infections, and reduces inflammation linked to diabetes complications. 7. Hyba del Sapo. Hyba del Sapo contains cholesterol-lowering, anti-inflammatory, and hypoglycemic properties. It is rich in flavonoid and saponins that aid in reducing blood sugar, lowering cholesterol, promoting weight management, and supporting cardiovascular health for diabetes.
Yeah. Get the iron. The liquid iron.
Just iron?
Iron. Just take the iron for now.
Okay.
Because what happened, we take your creatinine level test, they're going to tell you that creatinine is high, right?
Yeah.
Or that potassium may be high if I give you what you really need right now. But I could begin, and this is how I begin people on dialysis. This is going to give you energy. What this will do, they wash your blood to remove the impurities. They also wash out the minerals that makes you strong. That's why when you get off the dialysis, you're hungry.
Yeah.
You want to eat
Yeah, definitely.
because they rob you of your energy. Well, if you take about 6 tablespoons of this, you can feel that. I would have replenished the minerals. Then gradually I would begin to give you potassium phosphate to open up the kidneys so that your urine could start again and a diuretic. We have done it. We have done it before. But like I said, those of us that we treated, because they couldn't maintain that diet, it was difficult. But this one man said, I'm going to go all the way with you, and he's off the dialysis machine.
Say that again.
Because he adhered to the diet,
Oh, okay.
he went along with the diet that is most unnecessary.
Revitalizing herbs for people on dialysis machine. According to Dr. Sebi, people on dialysis machine need their blood to be purified and a lots of energy, liquid iron and potassium phosphate. However, the herbs to revitalize the body system for people on a dialysis machine after cleansing from diabetes and dialysis are 1. Lily of the Valley. Lily of the Valley contains cardiac glycoside, mild diuretics, and detoxifying properties that benefit kidney function, help reduce fluid buildup, improve heart strength, and support blood circulation, potentially elevating dialysis-related complications like fluid overload or swelling. 2. Sarsaparilla root. Sarsaparilla root is rich in antioxidants, anti-inflammatory, and detoxifying properties. It contains plant steroids and supports liver and kidney health by reducing toxin buildup, elevating uremic toxins, reducing inflammation, and supporting healthy kidney filtration for dialysis patients. 3. Conconsa cancasa. Conconsa cancasa is packed with alkaloid and antioxidant properties, support cells repair, improve detoxification, and strengthen immune function. It helps reduce inflammation in the kidneys, promotes toxins elimination, enhances immune health, and reduces dialysis-related fatigue. 4. Iris sea moss. Iris sea moss contain minerals like iodine, potassium, and calcium. Its properties support electrolyte balance and detoxification while promoting overall hydration, replenishing essential minerals lost during dialysis, boosting energy, and supporting tissue repairs and kidney health. 5. Bladder rock. Bladder rock contains iodine and alginic acid and supports thyroid and metabolic function. Its anti-inflammatory and detoxifying properties aid kidney health, improve toxin clearance, support metabolism, and replenish lost minerals, aiding dialysis patients' overall well-being. 6. Dandelion. Dandelion acts as a natural diuretic and detoxifier. It is rich in vitamin A, C, and K and support liver and kidney functions, aid in fluid management, reducing swelling, and promote toxin elimination, assisting dialysis patients in maintaining better hydration level. 7. Stingy nettle. Stingy nettle contains anti-inflammatory and detoxifying properties. It's rich in iron, potassium, and vitamins that cleanse the blood and improve kidney filtration, reduce inflammation, support toxin removal, replenish nutrient lost during dialysis, and enhance energy level for kidney patients. What next? Ensure you still consume at least 1 gallon 16 cups of spring water daily. Don't forget, the dosage for revitalizing is same as cleansing. Lastly, you will need to know how to end the revitalization if you are on water. For those of you who did water fast, ending the revitalization water fast after fasting for 21 days minimum required careful planning to avoid overwhelming your digestive system, which has been dormant during the fast. Proper refeeding is essential to restore nutrient intake, prevent complications, and ease your body back into regular eating. After cleansing for 3 days, the digestive system will shut down. Once the digestive tract shut down, the body will channel all its energy to healing, as there won't be any food for it to struggle with energy to digest. For those of you doing the water fast, slowly reintroduce solid food. If not, your digestive system will develop issue. My first recommendation is for you to start consuming fruit with high level of water like berries and watermelon 3 days before you finish the revitalization process. Before introducing bananas and apple on the last day before solid food the next day. Another important aspect is to consume watermelon and berries every third day of your fast in the evening to keep the digestive tract partially active. Remember, disease can only exist in an environment that is acid. Only consistent use of natural botanical remedies will effectively cleanse and detoxify a diseased body, reversing it to its intended alkaline state where disease cannot survive. Bear in mind that this last step is not for people who are on smoothie and raw veggie fast. What are the do's and don'ts of late Dr. Sebi? The do's are: 1. Follow a plant-based alkaline diet. Consume food from Dr. Sebi's nutritional guide that maintain the body's alkalinity. 2. Focus on raw or lightly cooked alkaline vegetables, fruits, nuts, seeds, and grain like spelt and quinoa. 3. Consume at least 1 gallon of spring water daily to hydrate, detoxify, and support bodily functions. 4. Cleanse the body regularly to remove toxin and restore balance using Dr. Sebi's 2 steps of healing methodology: cleanse and revitalize. 5. Consume food that are natural, non-hybrid, and align with your genetic heritage. 6. Keep meals simple and avoid combining too many different food in one sitting. The don'ts are: 1. Avoid foods that create acidity, such as processed foods, artificial additives, sugars, and hybrid fruits or vegetables. 2. Avoid all forms of meat, dairy, eggs, and other animal-derived foods. 3. Avoid the consumption of alcohol and caffeinated drink. 4. Refrain from consuming stimulants that disrupts the body's natural balance. 5. Avoid white rice, white flour, refined sugar, and other processed ingredients. 6. Avoid genetically modified organisms, GMOs, and hybrid plants that are not naturally occurring. 7. Avoid excessive or overeating. Allow the digestive system to rest. 8. Avoid tap water. Finally, we at Back to Eden with Clem are wishing you a speedy recovery. Thank you for watching. You can check out any of our Dr. Sebi's book written by Clement Jacob using the link in our bio. Kindly like, comment, and subscribe to our channel for more herbal health tips with Clem. See you in my next video.